Welcome back to the ISMA Insurance Agency video series on Medicare. In this video, we'll discuss two common approaches to Medicare coverage. The first is an a la carte approach, where an individual has Part A and Part B, sometimes referred to as Original Medicare, and adds a Medicare supplement and possibly a Part D plan. There are two main options for a Medicare supplement. The first is a Medigap plan, and the second is an association Medicare supplement. The second main approach is more of an all-in-one, where an individual buys a Part C or Medicare Advantage plan that incorporates Part A, Part B, and possibly Part D, and maybe even dental or vision. As I just mentioned, the first common approach is to have Part A, Part B, a Medicare supplement, and possibly Part D. The first type of Medicare supplement I referred to is a Medigap plan.
A Medigap plan is extra health insurance that an individual buys from a private insurance company to pay health care costs not covered by Part A or Part B, such as deductibles, co-payments, co-insurance, and health care when traveling outside the U.S. Many Medigap plans have no office visit co-pays or co-insurance. Medigap policies don't cover long-term care, dental, vision, hearing aids, eyeglasses, or prescription drugs. Medigap plans are identified by letters. Health insurers that offer Medigap plans can set their own premium rates, but the plans are standardized and must offer the exact same coverage. In other words, Plan G in New York must offer the same coverage as Plan G sold in Indiana. But premiums will vary among the insurance companies that sell Medigap Plan G.
The second type of Medicare supplement I referred to is an association Medicare supplement. These are private plans from members of the sponsoring organizations. For example, Indiana State Medical Association offers an association Medicare supplement to ISMA members. They provide several categories of benefits, often including basic benefits that cover all or most of Medicare Part A and B deductibles, co-pays, and co-insurance, major medical benefits that provide coverage for additional services that are not covered at all by Medicare, for example, coverage while traveling outside of the U.S., and coverage for a hearing exam. And some association Medicare supplements provide additional benefits, such as a Silver Sneakers gym membership and exercise program. The second common approach is a Medicare Advantage plan.
Medicare Advantage plans are offered by private insurance companies approved by Medicare. To get the most out of a Medicare Advantage plan, an individual will want to be sure to use providers and hospitals that are in the plan's PPO or HMO network. Payment of the Medicare Part B premium is still a requirement. The monthly premium is often lower than the Medicare supplement plans, and sometimes there is a $0 premium. However, there may be out-of-pocket costs such as deductibles, co-pays, and co-insurance with both Part A and Part B. If hospitalized, patients will pay the Medicare Part A deductible. Medicare Advantage plans often include extra benefits such as dental, vision, hearing, and wellness programs. It's very important to note that the plan can choose not to cover the cost of services that the insurance company doesn't consider to be medically necessary. Individuals who choose Medicare Advantage plans should be sure to check with their insurance company before they receive costly services.
I've heard Medicare Advantage plans referred to as the more you go, the more you'll pay. If an individual is healthy and needs few medical services, a Medicare Advantage plan may be a good fit. However, an individual with ongoing medical issues may have co-pays and co-insurance each time they see a provider. If hospitalized, they could have a deductible that is likely to be over $1,000. Medicare Advantage plans typically have restrictive provider networks, and individuals will face higher fees if they choose an out-of-network provider. Medicare Advantage plans that provide more freedom to choose physicians may be limited and costly. There's a lot to think about when deciding on an approach.
Yes, in many conversations I've had with our members, I've identified 4 key considerations. The first is cost. Medicare Advantage plans will have lower premiums than Medicare supplements. Medicare supplements usually have lower out-of-pocket costs because they cover deductibles, office visit copays, and coinsurance. The second is budget predictability. Because Medicare supplements cover Part A deductibles, copays, and coinsurance, it's easy to predict Medicare costs regardless of the number of claims. With Medicare Advantage plans, costs are less predictable because the amount an individual will pay for deductibles, copays, and coinsurance will vary depending on the level of medical services they receive. The third consideration is provider choice. Traditional Medigap policies and most association supplements provide benefits for any doctor or facility that accepts Medicare assignment. Medicare Advantage plans limit choice of hospitals and physicians within an HMO or PPO network. And the last consideration is travel and lifestyle. Some Medicare Advantage plans operate within a certain region. For individuals who live in more than one state during the year or travel frequently, a Medicare supplement may be a better choice.
That's a quick overview of the 2 main approaches to Medicare coverage. To learn more, visit medicare.gov. You can also find additional information and check out our other videos at ismaia.com. As you're making decisions, we encourage you to contact ISMA Insurance Agency for individualized guidance from one of our agents.